Today we will talk about domestic policy in the United States and the social programs that fall under this category. Domestic policy is government policy that provides services to its citizens. Before the Great Depression, the government didn't provide assistance to citizens with health problems or disabilities, or provide aid to those living in poverty. Instead, citizens relied on their families, communities, churches, and charities to help meet their needs. This all changed with the Great Depression. Due to the bad economy, so many Americans were unemployed that living in poverty was a nationwide problem. People couldn't afford to help one another, and churches and charities couldn't keep up with all the people in need. In response to this nationwide poverty, President Roosevelt introduced a series of government programs to help people. He called these programs the New Deal. Government programs that provide citizens with financial help are called social programs, and today's social programs are divided into two categories: public assistance and social insurance. Public assistance gives money to people with extremely low income. Social insurance programs help people who are unemployed, sick, or elderly. First, we will discuss public assistance programs. The three largest public assistance programs are food stamps, Medicaid, and welfare. The food stamp program began in 1961. Its purpose was to help low-income families buy the food they needed and to help farmers get rid of surplus crops. Since its beginnings, the number of Americans enrolled in food stamps has greatly increased. Congress created Medicaid in 1965 to help people with low income pay for health care. Because it covers medical care, Medicaid is an expensive program that is paid for by federal, state, and local taxes. The welfare program used to be known as Aid to Families with Dependent Children, or the AFDC. The program began during the Great Depression to help children whose fathers had died or were ill. By the 1980s and 90s, most children receiving money from the program lived in a single-parent home and weren't receiving child support. The program began to draw criticism based on the viewpoint that it wasn't actually helping people out of poverty. Many families who received welfare payments did not seek out employment because they would make less money working a minimum wage job and paying for childcare. In 1988, Congress created a new program called Job Opportunities and Basic Skills, meant to help people find jobs so they didn't have to rely on welfare. In 1996, the federal government ended AFDC and began giving the funds to the states to implement their own welfare programs. The states were required to follow guidelines on work requirements and time limits. Now we'll discuss social insurance. The federal government has four main programs: unemployment insurance, Social Security, Medicare, and the Affordable Care Act. Unemployment insurance is a government program that helps people who have lost their jobs. The state and federal governments work together to provide the insurance, which is funded by taxes paid by employers. If a worker is laid off from their job, they can apply for unemployment insurance and temporarily receive money from the government until they find a new job. Social Security is a program that benefits retired or disabled workers. During a worker's career, Social Security taxes were taken out of their paycheck. Then, when they retire, they can start collecting the money they paid in. This allows people to retire but still have a small income. The government spends a lot of money on Social Security, and some people worry the program will run out of funds. Congress has already voted to increase the age you can begin receiving benefits from 65 to 67, and more changes will need to be made to continue the program. On a similar note, Medicare is a program that helps elderly Americans pay for health care and hospital bills. Like Medicaid and Social Security, it is an expensive program. The Affordable Care Act is a program that helps people find and pay for health insurance. It was passed by Congress and signed into law in 2010. Although more than 30 million Americans have gained health insurance since its passage, it has been the subject of much controversy, since it requires Americans to have health insurance and taxes those who do not.